Hello there, everybody, and welcome to Return to Care, an MSD webinar focusing on tackling the post-COVID healthcare challenges in Central and Eastern Europe. Thanks for joining us. Why are we having this event today? Well, as we all know, the COVID pandemic has had not only a devastating toll across Europe, but it's also caused huge delays in the delivery of other treatments across Europe. We are going to focus today on the particular impact in the Central and East European countries, where rates of treatment and other key indicators were lagging behind those in Western Europe, and that problem has been made worse by the COVID pandemic, particularly because in many of the countries, healthcare systems have historically been relatively underfunded and exacerbated by other problems, such as delays in access to the most innovative treatments. You'll be aware of some of the figures: a 40% drop in cancer diagnoses, 70% drop in the number of patients seeking cancer services of different kinds, and cancellations in treatments, particularly in Poland. One figure is 30%. But we're going to look at some of the solutions, the responses that national governments can and should adopt or are recommended to adopt from our panel of experts, and also look at the various schemes and programs that the EU provides and how they can help and be used by national governments to tackle this very large problem. We're going to be hearing from Mr. Andrei Baciu, who is Romania's State Secretary for Health, shortly. But before we hand over to him, I'd like to invite David Earnshaw, Associate Vice President of MSD, based here in Brussels, where I'm currently residing, to make some introductory remarks. David, please.
Great, thank you, Simon. Good afternoon, everyone, and thank you for joining us during your lunchtime. MSD is delighted to be hosting this event with Ruud Pedersen on what is just about the single most important healthcare challenge facing Europe. And this is the challenge we face tomorrow, metaphorically, but tomorrow, of course, starts today. Namely, how do we overcome the disruption that the pandemic has caused, and how do we get back to care, especially in Central and Eastern Europe? The countries of Central and Eastern Europe are a particular challenge, and I'm delighted that we've initiated this event to focus on them. But this is a long-term crisis that affects not only the CEE countries in the European Union, and not only the European Union countries. The country I know best has effectively done little more for a year, other than COVID and vaccination. In that country, there's now 500,000 people waiting for surgery, and that's a so-called rich G7 country. We need to focus on Central and Eastern Europe because healthcare systems are historically under-resourced in those countries. There's already lower life expectancy and higher mortality across many diseases, and inequalities in access to healthcare in the CEE countries is expected to deepen with the crisis. Meanwhile, as Europeans, we are increasingly focused on the need to get beyond a two-speed Europe in healthcare. We should be planning to get beyond a passport, meaning the difference between access to care and not having access to care in Europe. This is the Commissioner's vision, and I hope as Europeans we share that vision. I expect we will mention today the lessons learned from the pandemic. I think it's fairly clear that the most enormous lesson learned is the elephant in the room. Europe's healthcare systems haven't been able to do the pandemic and normal healthcare together. It's been either one or the other. And this is especially the case in the countries of Central and Eastern Europe. So strengthening our healthcare systems has become a socioeconomic and political imperative. From now on, our healthcare systems in Europe, and probably elsewhere as well, have become one of the most important offices.
I've got a therapy session at 4:30 as well.
Next, they're going to need the resources commensurate with being the most important offices of government. So at that point, Simon, I'll hand back to you to start looking at the return to care and the special challenges faced today by the countries of Central and Eastern Europe.
Great, thanks a lot, David. Okay, so if State Secretary Andrei Baciu is ready, the State Secretary is also the coordinator for Romania's COVID vaccination, so he can talk about both problems. Mr. Baciu, are you there and ready to start? You're both muted and your camera is off, Mr. Baciu, so. Let's just give Mr. Baciu another minute or so. He was on his office connected successfully earlier, so okay, I understand he's just disconnected, and I hope he's going to reconnect and be able to join us. Okay, here he comes now. Hello there. Just a little bit of patience. I just saw, okay. Hello there, Dr. Baciu. You're muted. If you could unmute yourself, that would be enormously helpful. Hello there.
Hello. You hear me? Can you hear me now?
Absolutely, yeah.
Thank you so much.
Thanks for joining us. Great you could make it at a time of extreme demands on your time and pressure in the middle of the pandemic. Okay, if you're ready, I'd just like to hand the floor over to you to hear about the situation in Romania. Thank you.
First of all, thank you so much for the kind invitation. It's a great pleasure for me, an honor to be a part of this very, very interesting debate. I would start by saying that these kind of events are of extreme importance for the healthcare community, for everybody who plays a role in the healthcare environment. Why? Because the pandemic has affected us all, not only the healthcare systems, not only the societies, but also at the individual level. So I believe that all our priorities have changed in the past, I don't know, 18 months. And it's a great opportunity to realign our priorities for the immediate future, given the fact that we might say that we have a couple of 2-3 months, maybe, anyways, a couple of weeks at least, in which we can realign and reprioritize everything we do and prepare for whatever is going to come starting with September. It's an extremely important moment for us, not as a member state, not only in Romania, at the European level, at the global level. And it's time to build back and to build back better in order to be much more prepared for any further event in this pandemic that might occur. Our healthcare systems depend, regardless of their efficiency. If we look at and if we compare how various healthcare systems have performed during the pandemic, and then also even more during the vaccination campaign, we will look and we will see that the efficiency and the performance is not dependent and is not symmetric to the previous pre-pandemic output of those healthcare systems. So we see that things and the context and the social aspects have a huge impact on the performance on the healthcare system, and we need to reimagine, we need to redesign the whole functionality of the healthcare systems in order to be more resilient and much more prepared to face such tremendous healthcare crisis like the ones we have now. Even more from a political and from a leadership and from a management point of view, we have to take into consideration that people's life and patients' lives are at stake. Not only COVID patients, but also the other pathologies which have had limited access to healthcare services. So also now during this summer, but for the months to come this year, we have to reanalyze our priorities within our healthcare system. We have to reanalyze the budgetary allocation. We have to reanalyze the health policies, because at the end of the day, it's all about providing equally access and qualitative healthcare services to our patients. So I would not go any more into details. I'm open for any debate or for any questions, but I think that this should be our priorities. We should look and we should use these couple of weeks that we have now ahead, and also the next months to come, and all the lessons that we have learned in the past year and a half, we should put them to good use in order to be able to have better results in facing this new variant of concerns that will most likely appear. Thank you so much once again, and I truly believe that it's of extremely important to have these debates, to have this opportunity to talk and to realign our priorities. As I said, I'm truly convinced that the pandemic has changed us, even at the individual level. So what our priorities before the pandemic, I'm not sure that they are still the same today. This is why it's extremely important to be able to reanalyze all the things that we want to do in the next couple of weeks.
Great, thank you very much, State Secretary. Just a question on financing. You mentioned there the budgetary priorities. When your minister, Mrs. Mihaela, is in cabinet discussions, is making the case for healthcare expenditure, does the rest of her colleagues, do they see healthcare as an investment, as something that should be a priority for spending in the post-COVID environment?
Well, definitely, we really have to rethink our budgetary allocation and investment funds, because, of course, you cannot transform a healthcare system overnight. So there are things that you can change, and there are things you cannot change. You cannot build overnight, even though we've seen a couple of examples around the globe where people try to build modular hospitals overnight, but this is not a sustainable solution. So in order to have other resources, you really have to use and redesign the budgetary allocation in order to modernize and, if the case, build new hospital, new medical infrastructure. Of course, European funds are of great interest, but I would mention the European plans going on. These are historical opportunities. We have to take it into consideration, and especially also for the chronic diseases and for the chronic pathologies. Let's take as an example the cancer patients. If we look at the cancer patients, they really need to be able to have an immediate access to healthcare services. We've seen that the pandemic crisis have modulated the healthcare services, the existing ones, and unfortunately, patients with different pathologies, like oncology patients, for instance, have had a limited access in the past couple of months. So yes, we really need to rethink our fund allocation, and of course, the healthcare infrastructure has to be a priority. For Romania, is going to be a priority because this is one of our vulnerabilities. The healthcare infrastructure we have, unfortunately, we didn't manage to build lots of hospitals in the past couple of years, but with the help of the European funds, this is a top priority for us. And healthcare infrastructure is something that we really consider as a top priority for the next couple of years.
Okay, and is healthcare included in your national recovery program? Is that one of the areas of spending that you've identified?
is one of the top areas in this program. We have a couple of billion euros allocated for this within the healthcare sector, and indeed the healthcare infrastructure is one of the top priorities. Basically, what we're going to do, we're going to look at the existing projects, and we're going to find a way to best allocate these resources to the healthcare infrastructure projects already existing. You probably know also why, because within this program you have to be able, you have to be able to finalize the projects in a couple of years. So you don't have really time to start from scratch huge health infrastructure project, because you will not have time to finish them. So it's best to look at programs and projects that are already mature in a way that will offer you the best predictions to succeed in finalizing this project, to be able to use the money, because otherwise you have to find other financing, other budgetary solutions.
Okay, and the EU's Beating Cancer Action Plan, is that also a program that holds some helpful opportunities for you?
Here, even more, and I have to say that I've been close to the local initiatives that we had following the launch of the European Beating Cancer Plan at the beginning of February, if I'm not mistaken, 3rd of February. So this is one of the projects that at the European level you can see the leadership in changing the paradigm that patients, the oncology patients, are facing and are living nowadays. We are taking this very, very serious in Romania, because this is one of the pathologies where Romania can make a difference. There are two main initiatives, but I will refer to the one in the Romanian Parliament, which is working in developing the first national plan against cancer. In contrast with other countries that already had implemented a couple of plans and now are moving much more into details, we are working on finalizing the first national plan on beating cancer. And I'm more than happy to say that, for instance, 2 weeks ago, I had an initiative with one of members of the Romanian Parliament, and we had also an event on this by which the Romanian Parliament is going to adopt the National Day for Cancer Survivors. So I'm very happy to say that I had a role in generating this initiative, and hopefully this will be one of the events that will change the paradigm, because at the end of the day, this is the main idea behind the European Beating Cancer Plan and behind all the national initiatives. The science and the technology in healthcare provide us with a solution. So the cancer diagnostic should not be anymore a sentence for the patient's life. But we have to work together, we have to work strong together to transform it, and to change the paradigm and the perception towards the cancer diagnostic towards a chronic disease, because modern medicine can provide us with such solutions in which most of the cancers will be transformed in the near future into only a chronic disease, with, of course, a couple of conditions. You have to early diagnose it, and you have to have an immediate access to provide an immediate access for patients, and then also cutting-edge technology and treatments. So if you have this in place, together with screening and information campaigns, so on and so forth, you can transform the cancer perspective from today's perception, which is a sentence, towards a chronic disease, a life with a chronic disease. So at the end of the day, yes, the European Beating Cancer Plan is a strong leadership program. We at the national level we are working on developing our national program, and I'm very happy to say that I also had some initiatives within this program that hopefully will help as many patients as possible.
Dr. Bacci, just one more question, if you'll allow. Just you mentioned their access to innovative treatments, and we know that in your country, and indeed in many countries of Central, Eastern and Southern Europe, the delays in getting access to the innovative treatments are very substantial, several times greater than in the West. The EU is working on a revision of the pharmaceutical legislation to speed up access to innovative treatments. Do you think that that process will yield results? Is that something? Is it a priority for you?
Well, as well, behind this initiative is basically trying to provide for all the European citizens the same access to innovative treatment, to the treatment that medicine can provide us today. So this is the idea behind this initiative at the European level, because access to treatment varies, unfortunately, a lot from countries to countries at the European level. Even in Romania, as you very well known, speaking of innovative treatment, we have cases where there is a delay of years in accessing innovative treatment, which in most cases makes a difference between life and death. So it's totally unfair, this difference between access to treatment in one European country versus another. So trying to level up the access that every European citizen has at the European level to the best practices and results that medicine offers you today, of course, is something that we assume even at the national level. These are our objectives, trying to reach the European standards in terms of medical assistance in general, but also in particular in terms of innovative treatment. Let's hope that at the European level, the best solution will be identified. But definitely, yes, in Romania, we are thinking in finding the best solutions for the Romanian patients and reducing the gap between what medical services are provided here at the European level. So this is something that we consider with the top priority as well.
Great. Dr. Baciu, thank you so much for joining us today, for taking time out of your doubtless very, very busy schedule. It's been great that you've been able to join us and speak to us. And we wish you and all the best with your efforts in Romania. Thank you.
Thank you so much for the kind invitation. It's been a great pleasure. And as I've mentioned, I think that these dialogues bring true value to our perception and to our action plan in reshaping the healthcare given this unexpected crisis. So thank you once again for the kind invitation. It's been a real pleasure. Thank you so much.
Thank you. Great. Okay. So the next part of today's webinar is a panel discussion, and great to hear from the State Secretary some of the challenges and the prioritization that's going on there. I will, before we start the panel, just quickly introduce the panelists to our audience. We have Małgosia Bogusz, a member of the European Economic and Social Committee, and has been one of the two co-rapporteurs on the EU's Beating Cancer Action Plan. Małgosia is president of the Kulski Foundation for Polish-EU Relations. I'm going in alphabetical order if ever anyone's worried about hierarchies. Professor Mark Lawler has joining us from Northern Ireland. Professor Lawler is a board member of the European Cancer Organization, and I saw co-chair of the Special Network of the Impact of COVID on Cancer. Next, we have Mr. Andrzej Risch, who's a director from the Commission's Healthcare Department for Healthcare, DG Sante, dealing with healthcare systems, and Professor Krzysztof Zielinski, firmly in last place thanks to the alphabet, but not in terms of hierarchy, president of the Central European Cooperative Oncology Group. So a great lineup of experts on this problem and the challenges that face us today. I'd like to start by asking each of the speakers what aspect of the challenges in the healthcare challenges, the return to care challenges, in the post-COVID, if we can speak of the post-COVID period, that they would like to highlight, and then over the course of the panel discussion, we'll move on to some of the responses. But starting with you, Małgosia, and your expertise on the Polish situation, but also on the Beating Cancer Action Plan, what aspects of the challenges would you wish to highlight?
Thank you, Simon. Thank you all. First of all, I would like to extend my sincere gratitude to the organizers for our today's meeting, for covering such an important topic for the health and well-being of all European citizens. From my perspective, being a member of the European Economic and the Social Committee, which is one of the most important EU institutions advising the European Commission and EU Parliament on the various legislatory and policy topics, I would like to share my highlights about EU Beating Cancer Plan, which can be treated as the European Commission's response to the challenges that COVID brought to public health and the broader social life of EU citizens. A little bit about our committee. The committee consists of the EU member states delegates from diverse portfolio of sectors such as employers, trade unions, and NGO. I'm coming from the NGO sector. So therefore, the opinions which we are formulating represent the broader view of the European civic society. Although our committee perceives the document, I mean the European Commission communication on Europe's Beating Cancer Plan as extremely valuable, it still needs to be improved in various aspects, such as an implementation scheme. And let me present you the highlights of our recommendation, which we forwarded to the Commission 2 weeks ago. I was a reporter of this opinion together with my colleague from Bulgaria, Milena Angelova. So covering the CEE region, I will say that both of us were really involved in defining the opinion in the way how it should be implemented in CEE countries. More and more often, I would say that we set the witness that different political bodies aim to categorize EU member states under first and second speed based on some unclear and mythical criteria. This approach should be abandoned from our point of view, as in order to efficiently fight with cancer and its socio-economic consequences, we have to present solidarity and aim for the one piece of march towards our common goal. So there is no room for slowing down, and there must not be exemptions talking about to split Europe, especially in the healthcare system and especially in fighting with cancer. Secondly, the definite advantage of the plan, which deserves recognition, is its multifaceted and innovative approach to tackling the cancer. This approach is based on prevention, early detection, diagnosis, and treatment, as well as improving the quality of life of cancer patients and survivors. While the prevention of cancer is crucial, it is equally important for the EU and member states to ensure the availability of high-quality healthcare infrastructure, including screening, diagnostic and treatment facilities, and health services. So such a wide-ranging approach needs to be further adopted to facilitate the equal involvement of all member states and their regions to help bridge any possible inequalities. So first, the recommendations of Europe's Beating Cancer Plan should be adjusted to the involvement of individual member states in the fight against cancer. Second, the problem of social inequalities in health must be addressed. As all we know, cancer is a highly unusual disease, so special attention should be devoted to tackling the issue in the plan. This is all the more important as morbidity and mortality are correlated not only with the type of cancer, but also with the location and social gradients. The Cancer Inequality Register, which was highlighted in the Europe's Beating Cancer Plan, should be as inclusive as possible and identify not only disparities between member states and between regions, but also social inequalities, especially regarding employment and gender. And what I have mentioned so far relates mainly to the conditions we knew even before the coronavirus pandemic. The emergency and global outbreak of SARS-CoV-2 has posed new challenges, and this is our discussion, and forces all to endure a change in the order of things. The trust of these changes has been above all on health. Access to many medical services, especially in oncology and cardiology, has been significantly impeded. It is therefore necessary to effectively address the COVID-induced disturbances in order to prevent a cancer tsunami. So massive delays in cancer diagnosis and treatment reduce the chances of recovery. This is very easy. And in this context, Europe's Beating Cancer Plan appears to be nothing short of salvation. Again, when analyzing Europe's Beating Cancer Plan, we could not ignore the significant regional differences in cooperational models and informational flows. We have also been concerned about the digital divide, which affects the elderly people residing outside major cities, persons with disabilities, and financially disadvantaged groups. This is also why we advised that plan must ensure standardization in this area. We appreciate the recognition of the strong link between the incidence of cancer and the factors such as the quality of the environment, healthy lifestyle, and diet. We welcome the plan aim of preventing cancer caused by viral infections by introducing popular-based vaccination programs. And the importance of nationwide vaccination programs such as HPV show extremely promising results, heavily reducing the spread of oncoviruses. However, we may not forget the vaccination rates and the level of progress of vaccination programs vary between regions. And this is also, I think, something which I would like to highlight a little bit later during the discussion. And just for the end, shortly, I will say that what we cannot afford as a European citizens, we cannot afford to remain neglectful in the fight against cancer. And the failure of this will create a snowball effect, leading to the accumulation of problems that could out of hand in no time. So this will be one of our discussion in the committee, that European Union needs a new EU Marshall Plan for the oncology. And in that, I would like to finish my introduction.
Okay.
Thank you.
Great. Thank you very much, Małgosia. Professor Lawler, what for you would you want to highlight about the situation that we're in now in terms of return to care? You're muted, so if you could unmute yourself.
Thanks, Simon. I'd like to start with a story, okay? 'Cause stories often paint pictures, and personal story. So the 29th of March 2000, my uncle died of a COVID-related illness. And one of my colleagues from Croatia, Edward Vidoliak, who's an oncologist, when he was reaching out to me to sympathize with me, he shared this shocking statement. He said, people are fearing a COVID diagnosis worse than a cancer diagnosis. At that time, that was right at the start of the pandemic, we didn't really have any data to either prove or disprove that statement. However, we now do. We reached out straight away and actually looked at both the impact on the cancer diagnostic and the cancer treatment pathway, and it was absolutely devastating. So we saw that like 7 out of 10 people who had a suspicion of cancer were not going to get their cancers seen, potentially by a specialist service. 4 out of 10 in relation to chemotherapy attendances. Subsequent work shows that, for example, 90% drop in endoscopies, which is the test we use to diagnose colorectal cancer, stomach cancer, esophageal cancer. So devastation right across the cancer pathway. And we've looked at this now at the European level through a study through the European Cancer Organization. There may be 1 million people walking around in Europe at the moment with a cancer diagnosis that they don't know they have. So that's a really startling figure. So I would have said the first thing we need to do is to address the pandemic and its impact on cancer. And part of that involves addressing the backlog. We reckon from the work that we've done that we probably need to be working at 130% of capacity. So just getting back to 100% is not good enough. And that's going to require investment. And I'm not going to beat around the bush in relation to this. We cannot do what we've done before plus 130%, with a workforce that has actually done Herculean work to address the COVID pandemic. So we need to, address that backlog as a matter of urgency, and that's going to require investment. And that investment needs to be upfront. And also that investment, if it's done properly, will actually save money in the longer term. Because at the moment, what we're facing, as Magdusa said, we're facing a potentially tsunami of late diagnosis of cancer. We're facing the fact that we'll get stage shift in relation to cancer, so it'll be more aggressive, more difficult to treat, more expensive to treat. So what we invest now is actually going to be value for money in relation to not only saving patients' lives, but also actually restoring a much better service, one that actually addresses some of the issues that we unfortunately had before the pandemic even struck. So the second thing then is restoring people's confidence. I highlighted that issue in relation to people fearing a COVID-19 diagnosis. Our work still shows that a lot of people afraid to go to cancer appointments. We need to reassure people that cancer hospitals are safe. We also need to make sure, and this is my real worry, is that this is going to create a greater divide between the East and the West in relation to, and I do a lot of work, as you know, Simon, with colleagues in Central and Eastern Europe. And I spoke last weekend at the Bulgarian Association of Clinical or Medical Oncology. And there are challenges that we really need to address now in relation to Central and Eastern Europe. Otherwise, we're just going to widen that divide that is irresponsible for us to have in the first place. And certainly the Europe Beating Cancer Plan needs to address that. So it needs to be for all of Europe, and really needs to be a way in which we can not only build back better, but I would say build back smarter, and use the lessons that we're learning, the resilience that we didn't have, that we thought we had. But we really need to address that backlog, because otherwise we're just building up a problem that is going to be very difficult to address if we don't address it now.
Great, thanks, Professor Lawler. I was going to come to you, Mr. Rees, anyway, but it's you coming at a good point in the order of speakers, because both Professor Lawler and Magdusa have spoken about the role of the Beating Cancer Action Plan. Maybe you'd like to comment on whether that could or should indeed be revised, or what you think about the role it can play in helping some of the member states tackle the huge problems of the post-COVID period. You're muted, Mr. Rees, just to remind you. Thanks.
Good afternoon, everybody. So thank you, Simon. I think I should start maybe from kind of baseline. We came into pandemic with a number of challenges already, but there were some positive developments. We really have to also think what's happened. So that the baseline was in the when you see the Central Eastern Europe in the EU. So the access and as measures in the unmet needs for medical declared population, this is what we are doing, was continue improve, in Central European countries, basically positively converging to the rest of the EU. So it was one good signal we observed before pandemic. The second was the budgetary stability improved as the healthcare expenditures kept pace with increasing GDP. Some comparative under resource health system cut with the rest of the EU, but dedicating some additional funding to health. But however, other member states kept lagging behind. And the third important positive factor, we have seen that population health outcome showed improvements. You can see this in number of indicators. Many Central European countries catching up with the rest of the EU. So there were some positive news, but then
Is it that's the pre-pandemic situation?
Yeah. This is what I would like to say, because often when we discuss today, this is like a big valley we came in, and we are going still through. But what's happened, because I think this is also important to see the COVID impact, on the whole population, because I really like to put it in the context. So of course we see the generally there was when we see the access mortality rate, it was really big, jump, so we were hit. We have seen finally the result is the life expectancy at birth in 2022 dropped by almost a year on average across the EU member states, with several Central European countries among the worst impacted. So we see the impact on COVID directly, but of course there were other results, not just COVID patient, already mentioned by speakers. So what we have seen also, I think because we are trying to understand, how this, resilience of the health system was tested, and of course, as it was said already, the health system, shifted the focus on COVID patients. So there were a number of measures taken preventing the transmissions, like doing more testings, monitoring, surveillance, of course, starting vaccination program. We have seen the shift of the resources, looking for the critical medical goods, how to get access to right medicines, physical infrastructure, the workforce's capacity, was shifted from one services to the COVID patients. Of course, on the cost, as already was said, from other services, including cancer. Then we started to see, of course, there were ways, many health system member states decided to kind of protect some patients group, including cancer patients, dialysis patients, try to continue services, but we have seen also simultaneously the access to primary healthcare, to first diagnosis, to just see the doctor started to be very limited. But also patients reacted, they didn't like to go to the hospitals because they were afraid to get COVID. We've seen also, when you see this from financial point of view, of course, the COVID and services, health services costed. Also, there were additional public funds dedicated to this work. Many other, of course, demand from economy were because of lockdowns, because of number of businesses problem and economical problems. Governance also, the governments, of course, were refocused the kind of interest in the COVID because of the urgency, and because, of course, finally, we also have seen some kind of new developments, like adoption of telemedicine services, the way the innovative way of organizing health services, trying also shift some, retrain people and so on. So all these things, really are now in the momentum that, how to get, out of this and catch up with number of difficulties we are facing across Europe. Is I don't think it's as and we have seen this data also from other member states. It's not just the Central Eastern European country situation. There's many countries. This catch up, situation is very important, and I understand there is no simple solutions like trying to do our best. First, I think it's important to go back to and get services available, to them. Of course, make them reimbursed also by different payment systems, and but this is the continued battle. So I think we'll continue to see this still competition between the COVID and non-COVID groups, but we hope, due to the hopefully successful vaccination programs, we will see the availability of hospital, primary healthcare doctors, specialized services to the patients.
Okay, great, Mr. Rees. Let's just finish with the round of responses to the first question. Professor Zielinski, good to see you're back with us there.
Yeah, well, I'm with you all the time. Hi,
No,
Mark.
no, no,
We
great.
didn't say hello.
Hi there.
Hi, Christoph. Good to see you.
Hi. Pleasure.
So, Professor Zielinski, you have a fantastic overview of the situation in Central and Eastern Europe. So, what would you like to highlight that we maybe haven't, the other speakers haven't flagged up already?
Well, I think it is important to mention two things here. One thing is, of course, that the situation was not in all pink and roses before. So it was a very, very serious situation in Central and Southeastern Europe. We know that there was always a shortage in all aspects of cancer care, starting from early recognition over to radiotherapy, where there was a shortage in very many countries. Drug availability, that is really one of the issues. Therapeutic areas, and finally also training, and I would say inclusion of oncologists in the international scientific arena, where we have a vast imbalance between Western Europe and Central and Southeastern Europe. Now, this is particularly concerning considering that these are all EU member states, and these are all EU residents. So we are accepting sort of without any protest that I would at least notice here, that there is a vast imbalance within Europe. From west to east and also from north to south. So we're sort of quietly accepting all this. And CCOG has built a very, I think, a very short, but I think a succinct and very constructive analysis, and also has shown how to get out of this very, very difficult situation.
CCOG, just to be clear, that's the organization.
That's the group, yeah, the Central European Cooperative Oncology Group, right? And of course, one of the major points that there is that also patient advocacy groups are not that prominent in Central and Southeastern Europe as they are, for instance, in Western Europe or even in the United States. So I think there was always a lack of aspects which have been covered in the context of cancer care. Now, of course, all this, and we all know that, COVID has put everything on a magnification glass. So whatever happened in the world, it was always on the magnification glass due to COVID. And that is, of course, true also concerning cancer care. And the majority of things have been said in this context. But I just want to stress here that we do not have to start from where we stopped, but we have to start from where we wanted to start, be it with COVID or without COVID. Now, another and the probably last aspect that I want to mention here is that if there's a will, obviously there's a way. If I want to, if I may cite, for instance, Romania, I was very much impressed by the Romanian spirit and the ability to launch vaccines against COVID in the country. This was really remarkable, and they were much more ahead, I must say. Well, I have no statistics, but personal feelings. So they were much more ahead of other countries which were much richer, or which are much richer, or according to the economic parameters, like for instance Austria and Germany. So obviously, if there's a way, if there's a will, there's a way, and I think that we could really follow this very, very, I think, scrupulously. Now, in the end, what I would want to say is what has been missing in my discussion until now, and what we have to discuss here, is early recognition. Early recognition, in my view, is a major problem in Central and Southeastern Europe. We have almost no screening programs going on. And I think that is something which Ms. Bogusz said before, and others mentioned before, is that we're, and you, Mark, of course, is that we are confronted with an avalanche, probably of new cases, which will happen like, I don't know, maybe January, February, because you all know, like even in much richer states, like for instance, the state of California, Gynecological error recognition has dropped by 80%. And the state of Washington, mammographies have dropped by 50%. So you can imagine where we'll be going. And of course, all the stages will be, so to say, upstaged following this crisis. So the problem is that I'm not so sure that the resources are available in Southern and Southeastern Europe to cover this avalanche, which is definitely coming. So I think we have such a series of problems that we should really start to work.
Okay, thanks very much, Professor Zielinski. Well, I agree. The problems seem very, very challenging indeed. It seems to me as well that many speakers have spoken about the need to redesign healthcare systems that were not entirely fit for purpose before. Some of the speakers talked about more resilient healthcare systems, and yet we have simultaneously to deal with very pressing problems, the tsunami or the avalanche of cancer cases. Is there a way to do both of these things at once, or is it just a case of identifying priorities and dealing with the most pressing ones? Who would like to share their thoughts on that? Professor Lawler, Mark, hi.
Simon, yeah, I mean, what Christoph says is absolutely right. Couldn't agree with him more. But I think there is sort of some light at the end of the tunnel, but we really need to act now. One of the things we did in the European Cancer Organization, as well as highlighting the problem through the use of data, we also said, well, how can data help us in relation to the solution? And we came up with a 7-point plan. As I emphasized there, number one, cancer backlog, we need to address it. Number two, we need to restore confidence of European citizens, as Christoph also said, and a number of the other speakers, so that they can go to their health service and be happy with that and not be worried. I think one of the things that we see, particularly in Central and Eastern Europe, is medicine and equipment shortages. So that's something certainly we need to think about. The other, and Christoph alluded to this, is the workforce. And particularly at the moment, I mean, the workforce have done Herculean efforts essentially dealing with COVID. And now we're expecting them to do the same thing with cancer and the avalanche of cancer diagnosis that's going to come. So we need to look at ways in which we can help to address some of the gaps that we see. We do see a brain drain from the east to the west. We need to stop that. We need to look at ways in which we can actually encourage people to stay in Central and Eastern Europe or to come back to Central and Eastern Europe to work. We also need to strengthen the cancer systems and use technology where it is appropriate. I think there are opportunities. And I think as well as that, we need to know what we're looking at. We need to be able to measure with data what's actually happening in individual countries and regions, because that allows us then to start designing solutions. But we need that, that enthusiasm. And also, I think, we need to work together as Europeans. Even though I work in a country that decided for some unknown reason to leave the EU, I think we need to work together as Europeans, because we can actually learn from each other in terms of best practice. Christoph highlighted what's been done in Romania. There's been some great things done in Austria, etc. So there are ways in which we can learn from each other, so that rather than competing against each other, we collaborate with each other. We compete against what our common enemy is, and that's cancer. So there is an opportunity here, because thankfully the Europe Beating Cancer Plan was put in place before we knew about a COVID pandemic, because we're definitely going to need it now. And the other thing is we need to invest in research. We showed about 1.5 years ago a paper we published, and a number of others have done the same, that people who are treated in research active hospitals have better outcomes. And in that regard, in Central and Eastern Europe, we need to invest in research as well. We did a paper that came out in the European Journal of Cancer last year with a lot of colleagues in Central and Eastern Europe, and really showing, one, we're not investing enough, but two, we're not probably investing in the right ways. So for example, lung cancer, stomach cancer, colorectal cancer are all big problems. Pancreatic cancer are all big problems in Central and Eastern Europe. And yet we're not researching in those areas. And also some of the thematic areas, we're focusing an awful lot on genetics, but not enough on screening, quality of life, etc. So I think there are things we can do that coherently can look to try and address the problems. So it isn't all gloom and gloom, but if we don't act now, it will all be gloom and doom. So, I mean, that's why we launched the Time to Act campaign that I have behind me in the office here. If we don't act now, we are going to have a big problem and we're not going to be able to deal with it, to be perfectly frank.
Right. Mr. Rees, the Beating Cancer Action Plan is there to share best practice across Europe. Do you want to maybe flag up some of the things that you think are useful to address the problems that our speakers have talked about, and indeed some of the other health programs that the EU has boosted in the wake of the pandemic?
Yeah, I think we already was mentioned the Recover Resilience facility, which is the huge over almost 700 billion program with grants and loans and so on. So governments are submitting or already signed the first national program. So. And we see the number of projects and ideas, as already mentioned by State Secretary, allocated to in different countries. So we'll see also here, investment in oncology, cancer field. But of course, we see also the cross-sectoral investment, like for example, digitalization. It will be not just in health, but also strengthening the networks, the power of networks, 5G, and so access to the kind of different services, including health. So we hope to see also this will help with the development of telemedicine, teleservices that were boosted by COVID. And I think now with the help of this money and then focus on digitalization, hopefully it will help also to increase access to, for example, to specialized consultations in oncology field and so on. The other pocket of money, which I think is important to mention, this is the EU for Health program, which is over 5 billion euro budget. This is almost 10 times bigger than used to be in previous financial periods. You can see it in this 2021 program, which is the first program we published just last week. We try to allocate quite substantial resources to implementation of the program, cancer program, and there will be resources available, for example, for something which I already mentioned, training and also knowledge sharing. We should not forget that we have existing networks, like for example, European reference networks, and at least few of them they are having quite already established cooperation across continent, and this is what is important, that those networks they're already gathering almost 1,000 clinical centers, including many of them from Central and Eastern European countries, and now they're enlarging. Most probably by end of this year, there will be almost 2,000 centers, and we see also the push from at the moment more centers coming from Central and Eastern European countries. So hopefully this model, which we discussed, that the knowledge is traveling quicker, and I think is the best form of help to the patients, and the kind of system we established through the European Reference Network can be also kind of replicable to other type of cooperation. So just to give you an example, we see that now we can set up the panel of experts, from few clinical centers, for example, let's say France, Germany, Slovenia, which can advise to the doctor working in Bulgaria or Romania or other countries. So and then to help finally patients from Bulgaria. So I think it is the kind of cooperation we have to continue to work. I mean, any development, for example, in the research field also needs, sustainable development. We have to see also the new, I think, quite interesting development in Europe, because we have the public private partnership between industry and Commission. So the most kind of famous is Innovative Medicine Initiative, Now we are coming. This one was with FPIA, with partnering with pharma industry. Now we are setting up new partnership, which is called Innovative Health Initiative, and this one will be together with the medical devices, pharma, and digital industry. And we hope this one also working together with member states, with some authorities, be able to deploy more important, projects, but also solutions to the patients, including patients in cancer. And the final one, I think it's maybe two final one is the European Health Data Space. This one would like to move health data. Again, we discussed this already, that how we can help with the response. We need knowledge, we need more research, we need also understanding better what's happening in the health system and get right solutions to the problem. Because Professor Zieliński said, if is the will, is a way. But of course, I think it's important to have the real evidence-based approach for whatever we do in policy, research, or treatment.
Okay, Professor Zieliński, I see your hand up, but after you've spoken on this, I'd like to bring Małgosia back in to hear what she thinks about what is happening in Poland at national level. But first,
please take her first. No, please take her first. I'm not in a hurry.
Well, if you wanted to comment on something that's already been said, then please do so now, and then
okay.
Also...
So the little aspect that I wanted to add to it is that we also, of course, have an ethical aspect here. So what we have is, of course, we have drugs which are available, which have been registered by EMA, and patients would qualify for all the inclusion criteria, etc. But we are not giving them the appropriate treatment because the drug is simply not reimbursed in a certain country. And I consider that this is really a problematic situation, again, considering that we all belong to the European Union, because in fact there should be a common understanding what is going on there, and I think we should not forget this aspect that we might also be held accountable for that by patients or patient advocacy groups.
Okay, well, you've led us onto a big issue there. Małgosia, do you want to come in on what Poland is doing before we tackle this issue of inequity of access or the ethical aspect?
Surely, Simon, thank you very much. Actually, before I will address precisely the situation in Poland, I would like to highlight the few things regarding the successful implementation of EU Beating Cancer Plan or other EU strategies. First of all, this is based on national level. So we need to make sure that all EU member states will be interested in implementation on the same level, the strategy. This is the main goal, and this is the point which should be addressed not only by the politicians, not only by the senior staff in the governments of EU countries, but also it should be addressed by patient advocacy group, by the civil society representatives, because the very good strategy, which is for sure EU Beating Cancer Plan and other one which are prepared by the European Commission after COVID pandemic, cannot be implemented without being very good seen on the national levels. And coming back to Poland, actually the day after the EU Beating Cancer Plan was presented by European Commission, I mean on the 4th of February this year, Polish Minister of Health together with our Prime Minister arranged a press conference and presented the national plan for the oncology, national strategy for the oncology. Of course, it's based on the findings in EU Beating Cancer Plan. So the first step in the right direction, I mean, that we as Polish people would like to, as a Poland, would like to implement Europe's Beating Cancer Plan in that that way or another way, it was done. But the thing is, as always, with the details and how to do it and with whom it should be done, who should benefit on that and so on. Definitely, thanks to Europe's funds, I mean national recovery funds, Poland will benefit definitely in healthcare, on the spending for healthcare. But without precise dialogue between all actors in Poland, but not only in Poland, I think that it covers all the EU countries, without the certain dialogue, how to facilitate the situation after COVID pandemic. We definitely in cancer treatment, but also in other areas which are also in very bad situation, without dialogue between the actors, I mean the stakeholders, politicians, patient advocacy groups, representative of NGOs, and also the pharma industry and other industries like service provider, like producers of services providers, and also companies which are actively preparing the new solution for telemedicine. Without such kind of dialogue, it will be very difficult to implement in very fast way the Europe's Beating Cancer Fund and other like other documents which can tackle the after COVID.
And what's the problem there? Is it a lack of communication, or is it because government is too top down and says this is for us to deal with without involving the stakeholders in the?
I will say that, you know, we have a lot of communication in Poland, and we have a lot of situation and possibilities to talk with decision makers, but still we are doing it in the silos way, let's say it. And we need to talk a little bit broader. This is what has happened in European Union when the Europe's Beating Cancer Plan was prepared. It was a huge discussion between all the stakeholders, all the actors on the oncology, key opinion leaders, scientists, producers, producers of innovative solutions, not only big pharma, but all of them. So when we would like to tackle such kind of situation in countries like Poland, in CE countries, we should build a big platform of the communication between government and what Andrzej mentioned. We should really focus on implementation the PPP, private-public partnership. And there are few very good steps here in Poland in that direction, and it should be elaborated further.
Great, thanks, Małgosia. So to come on to the question that Professor Zieliński raised, framed as an ethical issue, but we've known about the delays in access to treatments, the big disparity between East and West. It's not a new situation. Professor Lawler, do you see any solutions, seeing as it's tied up with reimbursement decisions, it's tied up with government's prioritization of healthcare spending against other competing national expenditure priorities? Do you have a magic bullet? Do you have any good solutions?
I totally agree with Christoph, but it's something that we need to have at the top of the agenda. I think one of the worries I've had in the past is it's sort of been stated as a fact, and we know, and there's data that can back it up. I can quote data from different countries and show comparisons, etc. But I think the problem is it's accepted rather than addressed. And that's where we really need to change the mantra. We need to say it's not acceptable. And I would agree with Christoph. I think one of the challenges is we need a sort of a stronger infrastructure of patient advocacy groups in Central and Eastern Europe as well. I think unfortunately there hasn't been, because that needs investment as well. It doesn't just grow out of thin air. Yes, there are I've met a lot of very enthusiastic patient advocates in Central and Eastern Europe, but there needs to be a structure that helps them to be as active as they possibly can. And I know there has been some work done in relation to that, because because the patient advocate is the one who can help to drive things in partnership with the health professional. And I think that sort of combination is much better than either of them trying to do it on their own, where they get pushed away, sort of thing. Whereas if you go as a joint collective, that can be very powerful. I think we need to sort of realize that, if we don't, put up that investment, so if you look at the GDP spend in relation to, most of the countries in Eastern Europe compared to the EU average, unfortunately, it's quite low. So we need to look at that, but also we need to spend appropriately. And so it's not just what you spend. So, throwing money at the problem is not going to solve the problem. It's how you judiciously spend in a way in which, actually addresses what are the key issues. So where are the pressure points, and how do we do that? How do we change the situation in relation to reimbursement? How do we use the European collaboration model in a context of, there has been looking at ways in which you can do reimbursement across countries. There was some work in the Benelux. I know Romania, and I can't remember, there was, there have been some initiatives that have looked to try and test this. And I think we need to look at supporting that. And I think that's where, the Beating Cancer Plan can help in that regard, to provide structures that allow you to address what is a problem that should be solvable. I mean, let's not, do anything about it. This should be a solvable problem. It's not something that is insoluble, but it needs a way, a mechanism. And I think that's where the Europe Beating Cancer Plan can help in that regard.
Yeah, Mr. Rees, you just put your hand up, but I think Professor Zielinski wanted to come in, but maybe let's hear from you, because Mr. Rees just first, and then we'll come to you, Professor Zielinski.
Yeah, just very shortly, because I think it's important to see what we can do on the EU level, and it's some good news. The good news is that we got into kind of agreement with the Council and Parliament to hopefully to get through the adoption of a new health technology assessment regulation.
Yeah,
the cooperation across continent in this field, and the priority field agreed by the institution is cancer medicine, so cancer treatment. I think this is the good news for all of us, because at least it's allowed this. Setting up the common standard agendas and concerning the assessment of the value of medicines. I think this is also important that we're able, and this is an ongoing process, cooperation between the pricing reimbursement body, health technology assessment, also with the regulatory agencies like European Medicine Agency. So then tomorrow we will have the meeting of pricing reimbursement authorities to discuss how to best share practices, how to work together. And we have the third element, which I think it's mentioned, the second, we call them grouping. The countries are coming together, like Benelux initiatives, country like from Benelux plus Austria and Ireland, more or less in the same kind of economic purchasing power. And country, Visegrad group, as probably you referred, the country from the Central and Eastern Europe, they also like to come together and discuss how to best purchase medicines for patients in need. So I think that if we see the light in the tunnel, there are lights there, and of course we need time. But for sure, the questions about how much money should be allocated from national budgets to health, it's one of those critical and remain.
Professor Zielinski, I think you wanted to come in.
Thank you. So I think there have been a lot of COVID recovery plans put together in Brussels, and I would just suggest this is a very high-ranking podium and panel. I would suggest to consider this to rebuild, or at least take this to rebuild this post-coronavirus situation regarding to cancer. So I don't, in my view, or what I've been informed, but I will happily be corrected. I think that none of the countries which has put forward any kind of proposals for these COVID recovery plans has included healthcare into it, but I might be wrong. This I would consider a major mistake, and you might still consider this to correct this, perhaps with a second call or with the call 1B or 1.2 or whatever.
I think Andre, you.
No,
Andre,
just correct. You know, the all countries are indicating investment in healthcare, different percentage, different projects. So let's see the final outcome. But our kind of general assessment is that we see that all countries are deciding, and it would be good, you know, to have a look in the end, you know, how money will be allocated to different projects. And we don't have yet analysis, you know, how what is the will. I continue to say what you said, will, and but this is the way. I mean, there is the indications of investing in healthcare and services, also training programs and so on. So let's see how in the end, when all programs will be agreed and signed by European Council, because the process is quite complex. They would be available for analysis.
And it's a longer term initiative. The review of the pharmaceutical strategy, one of the aims is the access to affordable medicines, as and as State Secretary Baciu highlighted as well. Is that, I think we're still at a relatively early stage, Andre, but do you see that going in the right direction? Has that been taken on board as a priority by the member states?
Yeah, I think so. I mean, of course, you know, the discussion about how the system should work in Europe and the member states, you know, small markets, big markets, the way, you know, medicines are accessible, affordable, and available, you know, all these things are coming together. You know, COVID, of course, showed a different, also number of new problems, including, for example, the global dimension, supply chain. You know, we are speaking not only innovative medicine, but also generic medicines. They also are good medicines. They should be accessible to patients. So you know, pharma strategy is aiming, you know, to kind of set up new framework for the future. We hope they'll be modernized, really trying to help with to answer to the questions which we put in these 4 pillars. When access, of course, and availability of medicine is one of those. But also we have to keep, you know, innovation in this continent. So why we have number of actions, by the way, is maybe also good to say that very important regulations is coming in force end of January next year, because finally the IT system is ready to go for clinical trials. And those clinical trials should be hopefully be easier to set up across Europe, both by industry, but also by academia. So I'm full of hope that the system also will help. I think it was mentioned in our discussion to access for developers, but also, of course, for patients to the good clinical trials.
Okay, good. Małgosia, just a quick question to you as our civil society representative. I mean, several speakers, Professor Zielinski and others, have mentioned the sort of the weakness of patient organizations in Central and Eastern Europe. Why is that, and is work being done to improve that? Because I mean, I notice in our dealings with patient organizations, Central and Eastern Europe is always underrepresented, and its voice isn't as strong as it should be.
Thank you, Simon. Oh, it's a very difficult question, I would say. And I think that no answers, you know, just right answers can be added just, you know, in a second. But definitely what we need here in CE countries, when we are talking about the better representation of the patient advocacy group, is also some kind of benchmarking and a larger cooperation with the organization in the Brussels or globally between the patient advocacy groups. So I'm really happy that Mark is together with us. So definitely the way how to improve the visibility and being recognizable by the government in CE countries by the patients is based on trainings, preparing them for being leaders in their countries. Because actually patients and patient advocacy group representatives should be leaders. They should be seen as leaders. They should be heard. And this is the way how we should treat them and how we should prepare them for this role, because they are one of the very important actors, one of the very important group of actors on our healthcare ecosystem.
Yeah,
and
absolutely.
This is the way how we should think literally about the role of the patient advocacy groups in future. I will end on that.
Yeah,
Okay.
but if I may add, because I think it's the number of interesting innovation as well, because in for example the Czech Republic established quite interesting model for patients advocacy and participation of patients in the decision making process. So I see they also are kind of very innovative ideas in Central Europe, and I think that the Czech Republic showed that you can also kind of bring patients to the stage, of the policy making, and then of course when you have this process, not just as an office to interact with the patients, but also place to grow, to debate, to participate in the decision making process. I think it's an interesting experience. It's also good to mention.
And actually, I will add, if I may, just comment. Definitely, this kind of approach is something what we should look for. Definitely, but it's as you mentioned, it's in Czech Republic, but it's not very normal in every single CE countries. I will say that this is the best practice which should be shared between other countries, and we should definitely try to build such kind of cooperation with the patient advocacy groups in all these CE countries, maybe some kind of bigger initiative.
Visegrad group.
Visegrad group, for instance, for patient advocacy group. I'm for that, and actually in our European Economic and Social Committee we will have few initiatives next year also focused on patient advocacy groups, which I'm involved in. So hopefully we will manage to create such kind of model cooperation with PAGs. Thank you.
Thanks, Małgosia. Mark, you raise your hand there.
Yeah, no, Simon, just to say, one, Małgosia, very happy to help you in relation to that. Sort of, we could bring some experience that I think could be helpful and useful. The second thing, and it was mentioned by Dr. Basiu earlier, is the potential for developing a European Cancer Survivorship Day to shine a light on the issue, because I think that would be very effective. So ironically, today, earlier on, I moderated for the European Cancer Patient Coalition an initiative that is looking for exactly that. So exactly a year ago today, we wrote to ECPC to say to them, we should develop a European Cancer Survivorship Day. It's now being driven through the intergroup, the Challenge Cancer intergroup in the Parliament. So that, I think, if we can shine a light on what the issues are in relation to cancer survivorship, which are many, including return to work, returning to normal life, reintegration into society, I think we can build a lot on that. So that's something, hopefully by next year, I'll be talking to you and telling you we have an actual European Cancer Survivorship Day, because I think that could make a big difference, and it would be actually around this time of the year as well.
Great. Professor Zielinski, I'm just going to allow you just to make a final comment, and then before I hand over to David Earnshaw to make concluding remarks. Professor Zielinski.
Very short one. I think what we should not forget is the training of young physicians. And that is something which is an enormously important issue, because you mentioned the Visegrad before. So I think particularly physicians coming from there, but not in all the countries, but from many countries, really need training, because a lot of attention is being put to eminence rather than to evidence-based medicine. So I think we really should concentrate on that and push forward the integration of Europe and the training of physicians. There's a lot of money around there within the European Society for Medical Oncology and in others. So I think that would be an extremely important issue, which we have to concentrate on further.
Okay,
Great.
Thanks very much. Great. Well, time flew by. And we're in the final couple of minutes of the webinar. So I'd like to thank you, all our speakers. And I'd like to hand back to David Earnshaw from MSD to make some concluding remarks. David, back to you.
Great, thank you very much, Simon. Thank you very much, everybody. I'd like to thank everyone for participating. This has been a really rich and important discussion, and I cannot possibly highlight everything that people have said in a short conclusion, but I'll pick on some of the points that I think are really important. As Mark said, above all, what we need is new investment to address the tsunami that is now upon us, and this is today Europe's common challenge. As Mark said, we need to build back smarter, but smarter for all of Europe. And the Beating Cancer Plan is at the heart of that. Margosata set out the range of priorities to be addressed in the Beating Cancer Plan and how working together in public-private partnership is so beneficial to everybody. Professor Zielinski spoke of the massive imbalance in Europe. As he said, COVID has put everything under the microscope and under the magnifying glass. We don't start post-COVID where we stopped. We start where we want to start. And I think that's a really, really important thought. It also brings us back to politics, because this is really about politics and it's about political will. It's about the political will to act to achieve a common European framework for cancer. Cancer patients deserve more, and that includes all cancer patients wherever they live in Europe. As I said at the beginning, the kind of passport that one has should not determine the access to healthcare for Europeans, and that includes in the countries of Central and Eastern Europe. Final point, which we haven't really mentioned in the discussion. This is not just about healthcare. For years, Europe has done employment law, and we fought discrimination in work and elsewhere. And I'm shocked that we're not thinking more ambitiously about using European employment law to stop discrimination against cancer survivors in employment. But that's a final point that I will add to our agenda for change. So thank you to all of our speakers. It's been a really great discussion. As we all know, these are difficult issues and we're not going to solve them today. Everyone involved today also is committed to changing the status quo, and clearly change is needed. So on that, thank you very much once again. Thank you in particular also to Simon, who you've been, as usual, a fantastic moderator, and thank you to your team at Ruud Pedersen.
Thank you, David. And let's not forget, let's thank all the people who've been following the webinar online today. It wouldn't be the same without you. We will be organising another webinar later in the year, focusing on some other important issues for Central and Eastern Europe. I hope you'll be able to join us then, but thanks for your time today, and thanks to MSD, David and your team for making this all possible. It's been a great collaboration. Thank you.